Good evening. My name is Gustavo, and I will talk about brain tumors, specifically about the glioblastoma tumors. This is the overview of the presentation. We'll be discussing the basic description of the tumor and the glioblastoma, the current diagnosis and treatment for this, the ABQT, and some innovations coming from this. So the basic description for a brain tumor is that a brain tumor is an abnormal cell growth mass in the brain. A brain tumor can be benign. This means that it's not harmful for the human, or it can be malignant, which means either it contains cancer or the size and location of the tumor can affect the brain functionalities in the patient. The brain tumor can begin directly in the brain, like a defect in the brain, or it can be a consequence of cancer manifesting here. So maybe the cancer started from somewhere else in the body, and later on, as the cancer progresses, the brain started to present signs of tumors. A brain's tumor's location, size, and growth rate can affect different parts of the nervous system. This is because being in the brain and the size of the tumor can start pushing around the brain tissue, causing major complications in the patient. This is related to what I told you before, that the brain tumor can be malignant. Basic description for the glioblastoma is that it's a type of cancer which is very aggressive and fast spreading. It occurs in the brain or the spinal cord, occurs at any age but is more common in the elderly, and can be very difficult to treat and may not even have a cure. And as you can see in the picture, the glioblastoma tumor has many types of forms, shapes, sizes, which makes it even more difficult for doctors to treat and diagnose. Some of the current diagnostic methods include the neurological exams, which doctors use to check the hearing, vision, balance, coordination, etc. of the patient. Problems here could help provide clues into what is wrong with the brain. Uh, Also, the imaging tests, which doctors use to have clues of the location and size of the tumors. With the use of MRIs, the brain can be lit and see what's wrong with it. Another diagnostic method is that doctors will take samples of tissues in brain or the spinal cord and then will be tested so to know what kind of tumor it's located there. Now we will talk about some current treatment methods. The basic ones are surgery, like a typical procedure to remove a tumor from the brain and remove as much as possible. Chemotherapy, it's the drug intake to target the cancer cells. Supportive care, this is more for the relief of pain and the symptoms caused by the illness from the tumor and the cancer. And obviously the radiation therapy, that is the use of radiation beams like X-rays to directly kill cancer cells. Now we will talk about the ABQT. The A will be that most patients with glioblastoma have a recurrence after any of the current treatments used has been implemented on them. B is how can doctors better predict, treat, and control glioblastoma recurrence. Q are the new techniques and treatments that have been in development to better treat glioblastomas. T is the innovative treatments to better control the reduction of the tumors in the brain and avoid it from coming again. So from this new innovation, that is the tumor treating fields, which use electrical fields to reduce the tumor's ability to multiply. So combined with other treatments, this makes it more effectively in treating tumors and preventing them from growing back again. Thank you for your attention.